Hello, Matthew Bell with Alzheimer'sProof.com, and today I want to address the question of whether hearing loss is associated with dementia, and if it is, do hearing aids help to prevent cognitive impairment? This has actually been in the news recently, and I thought we would give some of the articles and some of the research a little bit of a look.
So here's another interesting thing to me that over the past 30 years, it turns out research has been suggesting that possibly hearing loss and dementia are related, and more interestingly, that wearing hearing aids could actually help people to maintain better brain function. And you see this here from Science Daily in an article dated July of 2019. But this goes back quite a ways and has been picked up by a number of news outlets. So here you see the New York Times Magazine with an article titled, "Can Hearing Aids Help Prevent Dementia?" And that was just recent, February the 20th of 2020. And of course, people think, well, hearing decline is just normal, but then again, it is the case that there is an emerging body of research suggesting that diminished hearing may be a significant risk factor for Alzheimer's and other forms of dementia, and that the association between hearing loss and cognitive decline may begin at very low levels of impairment. Now, like I said, this goes back 30 years of research. So here you see the Journal of the American Medical Association in 1989 in an article titled "Relationship of Hearing Impairment to Dementia and Cognitive Dysfunction in Older Adults." There was a study involving 100 people, and they evaluated this level of impairment and in terms of hearing impairment and cognitive dysfunction. And the whole point of the study was to test the hypothesis that there was some kind of a link or that hearing impairment contributed to cognitive impairment. Their results were that there was an association between hearing impairment and dementia, and it says that it lends support to the hypothesis that hearing impairment contributes to cognitive dysfunction in older adults. So the Journal of the American Medical Association, Internal Medicine, JAMA Internal Medicine, another peer-reviewed journal. And in this one, Dr. Frank Lin of Johns Hopkins, you can see he's a specialist in hearing and public health. His expertise is in bone-anchored hearing devices, cochlear implantation, hearing aids, hearing disorders, and you can see his research interests include aging, cognition, and dementia, and so on. In the JAMA Internal Medicine Journal in December of 2013, in an article titled "Hearing Loss and Cognitive Decline Among Older Adults," Dr. Lin and his research team conclude that hearing loss is independently associated with accelerated cognitive decline. And especially, they were looking at incidents of impairment in community-dwelling older adults, but there is an association, according to this team of researchers, between cognitive decline and hearing decline. So back to the New York Times, they mentioned that in 2017, the medical journal The Lancet actually reviewed risk factors for Alzheimer's disease. Now, The Lancet is a well-respected medical journal up there with the British Medical Journal and the Journal of the American Medical Association. And again, their reference in the Times is to a 2017 study. Here you can see it, The Lancet, Dementia Prevention, Intervention, and Care from 2017. And what they determined was that hearing loss was the largest, statistically speaking, of the risk factors that was modifiable. So what they were looking at was what risk factors could potentially be modified. What could you do something about? You can't do anything about aging. You're just going to get older and your risk for dementia is just going to go up. But in terms of hearing loss, there is something you can do. You can do something with hearing aids. You can have cochlear implants. You can have surgery. You can do whatever. So this has led to an entire trajectory of possible research and possible intervention. And here you see from the hearing aid healthcare website, hahc.net, the article "How Hearing Aids Can Prevent Cognitive Decline." And this is from May of 2016. So this precedes the Lancet study, but just goes to show there are people who do take this seriously. Scanning down in their article, they talk about a study where those who had hearing loss had cognitive abilities that declined 30 to 40% faster than those with normal hearing. And in addition to that, the cognitive decline was related to the severity of the hearing loss. So the more serious the hearing loss, the greater the impairment to brain function. Now, there's a number of reasons why that might be. The question would be, why in the world would this be the case? And how possibly could a hearing aid actually help to prevent or stave off cognitive decline? And they give us three different possible reasons just to kind of get our thinking kickstarted. The first one is that hearing loss can lead to social isolation. So The idea here, withdrawing from social situations, sometimes it's written as a risk factor for Alzheimer's, and in other times it is listed as an early warning sign or symptom. But the idea is that if you have trouble hearing people, it's going to perhaps put a pressure on you to not want to be in social situations, and that can possibly be a risk factor. Secondly, hearing loss, they suppose here, could force the brain to devote too many resources to the processing of sound. So it's interesting to think that the brain has a finite amount of resources, and if you are impaired in terms of your hearing, then the brain may try to compensate for that, and it might affect memory, especially short-term memory, and even thinking. Third hypothesis here is that there could be just some injury to the brain that causes hearing loss and cognitive impairment. Now, you can substitute anything there for the word injury. Could be some kind of underlying condition. Maybe it's the amyloid plaques, maybe it's the acetylcholine deficiency, inflammation. But in other words, there could be some third factor that essentially causes both. Now, that possibility perhaps would bode ill for the idea of using hearing aids therapeutically if they're both caused by some underlying third factor and they're just correlated. But on the other two hypotheses, it is possible that hearing aids could potentially help. So thinking about this, these factors are not necessarily mutually exclusive either. So Science Daily, 2019, July, from the University of Exeter, talking about research done there in an article titled "Wearing Hearing Aid May Help Protect Brain Later in Life." So we're starting to not just see it as a conceptual possibility, but there's actually some evidence that hearing aids may actually have a protective effect. These findings provide early evidence that encouraging people to wear an effective hearing aid may help to protect their brains and reduce their risk of dementia. So they tested two groups, and they were tested with cognitive tests over the course of 2 years, and the group that wore the hearing aids performed better in measures assessing working memory and aspects of attention than those who didn't. And in terms of attention, there were factors that had to do with reaction time, concentration, and the like of this. Finally leading this Dr. Ann Corbett, and you can see protect here in all capitals. That was the name of the project, like protect your hearing type of thing, protect your mental function. So this Dr. Ann Corbett, she gives her opinion that previous research has shown that hearing loss is linked to a loss of brain function, memory, and an increased risk of dementia. And so here's the kicker. The suggestion from the research is that wearing a hearing aid could actually protect the brain. Fast forward just a little bit here. This is the Journal of Clinical Medicine in an article that was submitted at the end of 2019 in December, but published in January of 2020, the title of which is "The Effect of Hearing Aid Use on Cognition in Older Adults." And the question is, can we delay, decline, or even improve cognitive function? And here what's interesting is, after 18 months of hearing aid use, one participant group seemed to have improvement, not just improvement, but clinically and statistically significant improvement in cognition. But they admit, given the small sample size that was tested, further research is required. Summarizing this medical news today in an article titled "Cognitive Decline, Could Hearing Aids Reduce the Risk?" They talk about this evidence that in 18 months, the average scores across the cognitive tests had not improved. But those tests that assessed executive function showed significant improvements. So the previous study seemed to suggest memory, cognitive function both improved. This particular study corroborates that at least the executive function seemed to improve. And executive function is, of course, only one of the functional impairments that a person with a cognitive disability is going to experience. But what's interesting further is that it seemed that this improvement was more pronounced in females than males, and you can see at the bottom they give their suggestion that this might have been due to the fact that females use their devices more frequently than the males did. Back to the New York Times, the Journal of American Medical Association study and other studies suggest that perhaps we should be working harder to respond to hearing loss earlier. So given this research, given the fact that it seems that intervening, having hearing aids when hearing loss is presented can help to improve your odds for avoiding cognitive impairment, dementia, Alzheimer's disease, then it seems obvious that we should be working harder to respond to hearing loss. And so At the end here, experts advise anyone who is having trouble communicating to get his or her hearing checked. Primary care doctor can do an initial screening, and in fact, it might go beyond this slightly in the sense that if you wait until you're having trouble communicating, then you've already had some hearing loss and degeneration. I am not a medical doctor. I'm not a medical researcher. I can't give you medical advice or diagnose anything. And so I can merely echo what has been written here, but it does seem intuitive that having annual hearing screenings could be a very good way of getting a fix on very subtle changes in hearing that might help you to intervene at the very earliest stages. And imagine if there is this positive correlation between hearing intervention and the ability to stave off, avoid Alzheimer's disease, or even improve cognitive function. So it seems promising, and I thought I would bring it to your attention.
Thank you so much for being with me today. If you found something of use in this video, I do ask that you like the video, subscribe to the channel, click the notification bell if you want to be alerted to new content as it becomes available, and if you think that the research might benefit someone else that you know, please share the link with that person. I thank you so much for being with me today, and I look forward to seeing you again in another video. Thank you.